this video today in no way constitutes medical advice. It is just purely anecdotal. What I'm doing in clinic and what I'm finding is helping to dampen down the occurrence or the frequency of inflammatory reactions. But it's purely anecdotal based upon my own personal patient-to-patient experience. So what am I doing? One of the things that I'm doing is what I've always done for minimising vaccination risk, and that is using something developed by Dr. Herr Reckewig, I think over 40 years ago. And it's called R1. It's a mixture of different nodes of homeopathics aimed at down-regulating or modulating the immune system. So what it does is reduces, it's an antipyretic for babies. It works every single time. And what I do with children and what I do with patients who are getting any kind of vaccination, whether it's the flu or they're getting their jabs to go overseas, or indeed now COVID jabs, is I get them to take this R1, 20 drops in a litre of water, every day for 2 weeks prior and 2 weeks post. Or if they're super fit and well and they look fantastic on paper, vitamin D's at 125, HB's over 125, iron's over 125, and they're just looking really good, white cell counts really optimum, then I might just do a week pre, the day of, and a week post of this whole routine that I'm discussing with you here today. So that's number one, which is the Reckewig one. Number two is vitamin D. So if you want to get your levels up to 125 on your blood test before you actually have the test, and then you want to be taking 5,000 IU for 1 to 2 weeks prior, day of, and 1 to 2 weeks post. Some research is showing us that giving vaccine and probiotic contemporaneously to babies is massively down-regulating vaccination fever when babies are vaccinated. So I'm following that thinking with my adults with vaccination. I'm using a mixture of Saccharomyces boulardii, a big bomb of bifido and a big bomb of lactobacillus. They're your garden variety bacteria, and I like the Saccharomyces because it will help with yeast, but also if you've got any kind of autoimmune problem, you do need to be considering other strains. So speak to your naturopath about whatever probiotic is going to be best for you. The other thing that I'm using is either sulforaphanes or glutathione or N-acetylcysteine, or all three. And the reason I'm using that is because I want the liver to be able to methylate and detox as quickly as possible. And then also a week 1 to 2 weeks prior and the day of, and 1 to 2 weeks post, the zinc, 30 milligrams twice a day. So to summarise, before you get vaccinated, make sure that your full blood count is optimum. Your vitamin D is 125. You can measure serum zinc and serum copper and make sure that your zinc to copper ratio is 8:1. That's so that zinc can actually do its job. Then 2 weeks prior, the day of, and 2 weeks post, do your zinc, your vitamin D, your liver detox support, and your Reckewig one, and your probiotic. So having said all that, if you would like to access this but you don't currently have a plan to come back in and see us or need to see us for your health, you can book just a short 15-minute consultation with any of us. The cost of those range between $29 to see one of our new grads or $79 to see one of the senior pracs, so it's nice and affordable. And for all of our current NetMed patients, so if you are currently seeing us actively, we're actually offering a package of all of these products with a discount if you buy them all at once to make it a bit affordable for you. So that a link to that will be down below.